Guys, how are you doing today?
Wonderful. How are you?
Wonderful. Thank you so much.
Great. Thanks, Amy.
All right, let me introduce who we have here. We have Dr. April Larson, who is the director of the Clinical Advisory Board at Pathology Watch. We have Shawn Gibbs, who is the owner of Contour Dermatology, as well as a physician's assistant and an office manager. So Shawn, you are wearing many hats. And my name is Amy Cook, and very excited to be with you today. I'd love to start the presentation now. So before we get going into the presentation, we wanted to have a little bit of housekeeping. So for the attendee controls, if you would like to, anytime during the presentation, chat a question for April or Shawn or myself, type a comment in the chat and Q&A box, and we will be able to answer your question. You can also feel free to text me as well, and I can have April and Shawn answer any questions. My number is 949-813-0182. If you have any questions, 949-813-0182, or feel free to type a question here with the attendee controls. Also, if you're having trouble hearing us, check your speaker settings. You should be able to hear us by now. So we have a lot of space in today's webinar, so if you need to log out and log back in, go ahead and do that as well. Next this is very exciting. This live version of this webinar is CMM and HITCM-PP approved. So this is a CEU approved for the Certified Medical Manager and HIT Certified Manager as well. So after the webinar is complete, the index number will be emailed to the attendees, and the certificates are automatically generated in your CEU log. After the webinar, look for an email with a link to the recording as well as your CEU index number. And then some of these webinars are uploaded to YouTube. So you could check the Paycom member library for any materials referenced in the webinar or slides. So Paycom shares knowledge. We openly communicate and share it. We don't make any guarantees regarding the efficacy or accuracy of the information shared, and Paycom does not accept responsibility for the material, advice, or opinions of the presenters. So these opinions are our own. All right, let's get started. Now, here we go. In the start. All right, what we have here is one slide about Pathology Watch. So Pathology Watch is a digital pathology services solution that combines the expertise and cutting-edge technology of an academic center and the efficiency and customer service of a private lab. So one of the things that Pathology Watch does is we basically digitally transform pathology. We'll have April talk a little more about it later, but because this is very education focused, we're going to cruise right through it. And about Contour Dermatology. It was established with the goal to bring a professional, enjoyable, and patient-focused experience to the dermatology specialty. So with over 20 years of combined clinical experience, our Contour Dermatology team is able to provide our patients an all-inclusive home for their medical and cosmetic dermatology needs. So Shawn, we're excited to have you here.
Thank you very much. Appreciate it.
Thank you. And a little bit about Paycom, a national network of thousands of medical office managers, practice administrators, and physicians managing their own private practices. Paycom developed an unmatched state-of-the-art infrastructure custom designed to connect you to others for the purpose of sharing knowledge, networking, training, and ultimately mastering practice management. So now a little bit more about April. Dr. April Larson received her medical degree from the University of Utah and completed a research fellowship at the Tom C. Matthews Familial Melanoma Research Clinic at Huntsman Cancer Institute. After dermatology residency at Dartmouth Hitchcock Medical Center, she devoted herself to patient care for over 10 years. And April, while you're working with Pathology Watch, you also work in the clinical setting as well, right?
Correct.
That's right. So through Pathology Watch, she sees digital pathology as key to improving dermatology diagnostics through the enhanced correlation of microscopic and clinical skin findings. As the director of the Clinical Advisory Board and Clinical Implementation at Pathology Watch, she is focused on advancing patient care, and access by delivering digital pathology and artificial intelligence solutions to dermatologists both nationally and globally. About Shawn. Shawn is a Utah native. He attended Brigham Young University as an undergraduate, where he graduated in exercise science. He went on to graduate from PA school at Touro University in Henderson, Nevada in 2011. He's board certified by the National Commission on Certification of Physician Assistants. Along with several years of clinical experience that includes pediatric and geriatric care, he also has experience in general family medicine, dermatology, cardiology, endocrinology, pulmonology, and many other aspects pertaining to general health and wellness. Shawn thoroughly enjoys developing relationships of trust with patients and enjoys all areas of dermatologic medicine, including its medical and cosmetic applications. And one thing, as we noted a little bit before, Shawn is also an owner at Contour and the office manager. So all of those hats are going to really come into play when we begin our discussion. Thanks, Shawn.
You bet.
I just feel a little overwhelmed right now. I'm like, wow, look at the expertise that we have here on this panel today. I hope all of you attendees have got your questions ready. All right. So what we're going to do is we're going to talk a little bit about opening a practice during COVID. I mean, how difficult was that for you? Question one, Shawn, how did COVID-19 impact your practice opening up?
Quite a bit. Primarily, it actually delayed our opening. We intended to open our office the very first Monday in March, and clear that was the time when COVID really started picking up, and we started hearing a lot about it. And so we actually delayed our opening all the way until June 8th. We kept delaying it by 30 days and 30 days and 30 days, and eventually we got to a point where we just couldn't decide whether it was best to open or just kind of do an indefinite shutdown. And we found that the best option was to definitely just be open for our patients and to be able to just grow the business during COVID.
So what made you, in April, chime in if you have some questions for Shawn on this, but one of the questions that I have is, like, what made you finally decide to take the leap and open during a global pandemic? What was it that really made you decide? Was it just that you felt like the patient care was ready for it? And,
For me or April?
For you, Shawn.
Okay. Honestly, it was patient care. Between myself, Dr. David Smart, who's my partner in this business, and then there are two other physician assistants that are also on staff. We all kind of came from different areas, different offices, and combined forces to create this office. And there was just we still had a lot of need, a lot of patients that were calling, Facebooking, texting us that were wondering where we're at and what was happening, and they still needed us. So we decided that patient care kind of trumped the many challenges that COVID provided.
That's one of the things that, as I've been talking with frontline workers, that's resonated throughout all of the discussions, is just that there's such a strong ethic in the medical community that I know all of us on this call and webinar feel the same about, is that, when the patients need you, you show up. And I think that really speaks a lot to, being willing to take that risk and open.
Yeah, that's what was fun with for me meeting Shawn. So Shawn and I met while they were getting ready to open up their office. And I just kind of saw them kind of process through that and wait and be patient, and then in the end just decide, we really need to be available to people and to our patients. And one thing that's really unique about their office that I really appreciated is that, like you said, all of the practitioners there had already worked in dermatology, had a great deal of experience in dermatology, had patients that were kind of coming with them. And I think that definitely, I saw that play into what they decided to do.
Yeah, that's a great thoughts, April. Thank you. All right, well, let's go to the second question. All right, now we're really kind of getting transparent here, and I know that a lot of us feel this way on this call. What are some of the fears that you've seen patients have surrounding COVID-19 in your practice?
Specifically in our practice, the vast majority of fears just surrounded whether we were taking the appropriate steps to keep them safe when they came in the office. That was definitely a lot of the fears that were voiced to us is if I do come in, what steps is the office taking to be able to make sure that COVID isn't given to me, or, is anybody in the office? Do they have it? And if so, what has been done? And though that was definitely the greatest amount of fears that were voiced to us by our patients.
Interesting. And April, in your own clinical practice, what kinds of things are you seeing?
Yeah, in those early days, people just really didn't know. We all didn't know, what was happening with COVID-19 and how contagious it was, and who was at risk. And so at the beginning, patients really were kind of hunkering down and waiting, and a lot of people put off important care because they weren't sure, how that should go. And luckily, I think we're so lucky to live in this era where we have such good access to information. And so I think the medical community is really great about getting out that information, what we should be doing, how we should be, disinfecting and cleaning up, wearing masks. And I think the other big concern back then too was the lack of PPE and, how that was going to affect us. And luckily, I think Utah is a state that's really prepared and, had a lot of those things available, and we haven't experienced any of that yet. And so once I think people felt like they had access to those things also to stay safe, then people became more comfortable. I think we're all still very careful, with symptoms, and so I think that's the trickiest thing sometimes. For example, one of my daughters had just a GI illness, but it was the night before I had patients scheduled. And, so basically my staff just quickly called the patients and let them know. I said, I'm not feeling sick. I'm going to come in to see you. If you can, make a telemedicine appointment, let's do that, and convert you to telemedicine. And if you want to cancel, that's totally fine. But if you'd like to come in, I'm here and I'll be here. And so I think also giving patients those options, because again, patients don't want to stand you up, they don't want to cancel those appointments. And so I think just having easy communication and letting patients know that, we won't be upset if they have to cancel appointments, and being understanding that way also helps them.
That's a really great point that brings us kind of to our next question. What were some of the solutions that you use to help reduce anxiety and fear for patients? So that open communication, obviously, April, I'm sure really helps a lot. And do you, before we talk a little more about this, do you guys find that people are still as concerned about it, or do you feel like some of the fear has subsided? Shawn, what are your thoughts on that?
I feel like there's a healthy amount of both. There's definitely plenty of patients that come in that express, they're still wearing a mask, and that's one of the things we always have patients do, is to come in, wear a mask, and if they don't have one, we give them one. But there's plenty of patients that come in and express their, this is getting tiresome, this is getting old, and they're kind of fed up with the whole process of restrictions and everything, albeit as important as they are. But we have definitely noticed that there are patients, especially in the older population, that 55 plus community, that are still pretty nervous about going out, and if they have any comorbid conditions, that definitely is worrisome to them, as it should be. So, but that's really the area where we've seen the vast majority of patients feeling affected by it is in that older population. The younger population, not so much.
Yeah, that makes sense. What about you, April? Are you still seeing a lot of the same type of the level of concern?
I see about what Shawn does. There's some people who are really concerned and very careful, and there's some people who are a little bit more relaxed, and they're very respectful though. So they always kind of ask like, oh, should I put my mask back on? When you have them remove the mask and do their exam on the face. And I think people are very, sensitive to other people. But by and large, I'd say most of my patients that are coming in the office at least are feeling safe and, feeling like we're taking care of them and we know how to protect people. So I feel like most people, I've seen a lot less of that.
Yeah, that makes sense. So besides open communication, April, that you discussed, what are some other ways that you're helping to make people feel comfortable in the office? And I know that this is a big part of growing your practice during COVID, is people need to be able to feel very comfortable. And this is probably one of the reasons that people signed on for this webinar. So what are your insider tips and tricks for making people feel comfortable for coming in?
I think social media and, website information is really helpful to people up front. So before they come into the office, also office staff being able to field questions, or, when they're doing calls to confirm patient appointments, to make sure people understand, who they're allowed to bring, and, symptoms that they shouldn't come in for, and, kind of that early screening. Mm-hmm. And then I think in the office, letting them know how we're disinfecting the rooms, and posting signs so they know what to expect when they arrive, providing masks if they don't have them, so that they don't, it's not like they, forgot and have to run home or something, or miss their appointment. And so just us being overly prepared to provide them the tools to stay safe in the office, I think is really important, and we're lucky we have a lot of resources where we can make this signage, to say, hey, this is what, here's a mask, here are the symptoms that, stopped you at the door, and we're not going to be upset if you reschedule.
Yeah. I see. That's really interesting too, is that like that openness. That's one thing that I've noticed with the medical community that's been different as from before, is it seems like now there's a real focus on the individual patient preferences and saying, hey, if you don't feel comfortable, don't worry about it. Shawn, would you agree with that?
Yeah, I would 100% agree with that. And I think that is, one of the aspects of COVID that has started to shift medicine towards a little bit more of a better place for the patient as the consumer, and recognizing that they are coming to us definitely for service and for our expertise, but also recognizing that the more that we can be focused on patient experience and making sure that they feel comfortable in their environment, and combining that with the expertise that they are searching for, is just only going to be better for them. Mm-hmm. I know one of the things that we have done that I feel like has really driven patients to be able to feel a little bit more comfortable coming in, besides some of the things like April has mentioned in, posting those things in flyers and on our website. And but one of the things that we have done, just knowing the natural human condition and wondering, even though we're sanitizing between every patient, and we have the tool that we use for checking patients in is on an iPad, and we're sanitizing that between every patient. But one of the things that we have done is just kind of making not a show of it per se, but we have done that as the patient has entered into our office. Mm. So as they come in and we're taking their temperature, the first thing they see is one of our staff with a mask on, and then they see them wipe the countertop and then wipe down the iPad before they actually hand it to the patient, so that they know physically that it has happened. It's not just trusting that it's been done. Yeah. I know that's one thing that patients have noted and really appreciated, is that, I walked in and I saw them wipe down counter spaces and things, and I felt safe.
I really love what you said there. It reminds me of what Ronald Reagan said, which is trust but verify. So you are making, you're
Ronald Reagan. Wow.
That shows my age, but I think that's a really fantastic nugget of wisdom, is to just be visible about what you're doing. And you kind of referenced that as well, April, to when you were talking about showing the signs and posting them so people felt really comfortable. I love that.
Yeah. A couple other thoughts, Amy, is making paperwork available also online, and so patients don't have to spend as long in the office, so they're able to print out their forms online, have those filled out beforehand. Sometimes certain EMRs have links, to that paperwork where they can, do that beforehand. And I think also kind of just helping them shorten their visit, being very efficient about the way we get them in and out of rooms. And the way we schedule patients as well, how we stagger them in the waiting room, having less seats in the waiting room, all those little details matter.
Mm-hmm. Yeah, I love that. That makes a lot of sense. All right, to the next Q4. Let's see if I have any comments yet. Not yet. So guys, don't forget to chat me 949-813-0182 or type in a comment on the chat. All right, question number 4. What are some ways that you were still able to connect with providers to get referrals and source leads? I know this has been a humongous concern in the medical community, because how do you talk to people when their offices are closed? So Shawn, what are your thoughts on that at first?
So a couple different things that we have done that have proved to be successful so far is one, if previous relationships that we've had with other offices, whether between the four of us as providers, just reaching out to them specifically through having their individual contact information, obviously, and just letting them know that we're here and we started this new office and we're around to see your patients if you need us. But a couple of the other things that we've done is we've created a little bit of a quasi position. I don't know how long it'll last for, but we dubbed it a physician liaison position, where we hired somebody with the express intent of being willing and able to go around to these individual offices and just, for lack of a better term, represent us as an office. So it was a very selected, hand-picked person to go in and represent us and be there in almost a representative role to go in and leave flyers and leave cards and just be present more regularly than we can as providers, and to just stop by once a week, once every other week, and just say, here's some more cards if you need them, here's what we're doing, here's the updates. And then always finishing off that conversation with, our providers would love to sit down and meet with your providers anytime they're comfortable, and putting that out as an offer to do a Zoom meeting or a Google Meet or whatever it is, whatever platform you choose. But the more opportunities that we can get the bug in the ear of we are around is just going to drive up recognition of the practice and making sure that the providers end up knowing that we're there. But that honestly has been the most successful tool for us, is having somebody there relatively consistently and regularly to keep us top of mind.
I think that is so important. It reminds me of just like basically hiring a publicist, right? It's like a publicist for your organization to the other providers in the area. I think that's absolutely brilliant. April, what about you? What are some ways that you've been able to connect with providers at Pathology Watch or other places?
First, I just have to say that's such a novel idea of how to connect with people, because I think in general, that's when something that's challenging both with patients and with other physicians is just the personal relationships that we miss, that we're unable to kind of like make those connections like we're used to. And, the business world, they've been doing Zoom and Google Hangouts for years, right? Yeah. And this is not something that we've done in medicine until now. There were certain people that would kind of dabble in, telederm, before, and that's been a kind of popular issue even since I was in residency, but it hasn't really been adopted until it was absolutely necessary, until people really depended on it. We've seen that also with digital pathology, that is becoming more important to be able to be remote and still be connected with people. And so I think that's another thing that we experienced, is just communicating an email, but then saying, hey, let's get on a web call, and teaching people to be on Google Hangouts for the first time, in these different platforms, and helping people get comfortable talking that way. And it's interesting because, there's a lot of people, Shawn and I, we talked a ton of times on Google Hangouts before we even met, but you get to where you feel like you've met someone, you really are interacting with them on a very personal level, especially because you're like interacting in your, in your living room. And so I think that it's been unique, but it has surprised me how well you can create connections that way and get to know people that way, even though you're remote. And so I've really actually enjoyed that a lot. I've done that with patients as well, being able to connect with them. When they come in with a mask, you can't connect quite as well. You can't give physical touch as much and interact that way. And so it's nice, like we're interacting right now, seeing each other's faces, and it's actually been really enjoyable to me, and I think helpful as we've connected with people during COVID-19.
Do you think that will stay, April? Do you think that providers will continue to leverage technology more once we have a vaccine for COVID and maybe don't have all of these limitations?
I do, because I think it's so convenient for patients. And so, I really do try to keep up my, options with patients open and communicate when I think a telemedicine visit would be okay. A lot of times there are things that I can do, an acne follow-up or an iPledge follow-up. Aren't we all so grateful that we don't have to do in-office pregnancy tests right now for iPledge? What a convenience to patients to be able to, not have to do that and run in every month to have a visit. So there are those things that we can do remotely. And I think for a lot of other specialties, it actually is a lot more practical. Some things with dermatology, until we're able to get, really good imaging, for patients to do at home, we really have to see a lot of it in person, and the treatments have to be done in person. But in other fields, certainly a lot of that can be done remotely, and it's just so convenient that patients can not waste the time sitting in the waiting room, and they can be at home doing what they need to do until I'm available and can get on the call with them.
Yeah, I think that I really love that. I saw a cartoon the other day where it said it had a bunch of doctors sitting around a table, and they were like, "Oh, who needs digital transformation?" And there was this big old wrecking ball that was coming in their window called COVID-19. And so it was just the best visual. I was like, that's exactly what's happened. So hopefully we'll be able to take the silver lining learnings from that. But I love what you guys said, the physician liaison and, staying top of mind, that frequent communication, and then also using the technology tools, and with digital pathology being one of them. That was a really great response. All right, the fifth question is, what are some ways that you were able to cut costs and get the greatest value early on? One of the things that is top of mind for providers right now, as you guys know, as well as anyone, is that things are just, when volume's down, we've got to save money, and how do we tighten our belts? And how did you, Shawn, start something that is typically so expensive to open a new practice? So let's have you go first. How were you able to do this, get value early on?
Oh man, how much time do you have on that one?
We have lots of time.
A lot of things. I'm looking at my notes right now and saying, man, I have way too many options over there. I would say some of the most impactful ones is, in terms of value. I think value is an interesting word, because value can be a monetary type of thing, and value can also be what you are actually getting for that monetary purchase, right? One of the biggest things that we did that gave us the greatest amount of value is we looked at our employees and the MAs that we had hired, and the last thing that we wanted to do was impact anybody financially. And so we really wanted to try and come up with ways to keep our staff. And so one of the ways that we did that, it took a little bit of flexibility on both of our parts, but we did a lot of cross-training. And instead of having somebody who's just a dedicated front desk person, we had our MAs cross-training to be able to do front desk duties as well as back-end duties, and being able to take patients back and check them out and collect payments and do a lot of the things, so that instead of offering them decreased hours, it was, we're going to have to shift your roles a little bit, but you'll still be able to be at work and still collect a paycheck. And like I said, a little flexibility both ways. But that was a big one for us that helped not only with cutting costs, because we didn't hire on new staff, we just got a greater value out of what they were doing.
That makes a lot of sense to me, and I really love what you said there. And you're also a great example of living it, right? If you're the office manager and a physician's assistant and an owner, right? But it's going to help you in your practice, because you know exactly what's going on in your practice. Yeah. So I think that's really really important. One of the things that we do at Pathology Watch is we help the digital flow. And some of the, when we take, April's going to explain this better in a second, but when we take the slides that we'll upload directly into Emma, as you know, and be able to, improve operational efficiency by up to 40%, sometimes some of our clients are experiencing. And so to me, that's another example of being able to utilize your resources more effectively. April, what about you? What are some ways that you're able to cut costs in your own practice or at Pathology Watch and be able to get great value?
That's one of my main things, like you mentioned, is just that efficiency of practice. And so, while there was this pause with COVID-19, we all know we're going to go back and be as busy or busier, because, patients have kind of built up this need. It's not like those health problems go away. And so, you do have the opportunity in those moments to either, binge watch your show or kind of take your time and use it wisely, creating templates within your EMR that makes you more efficient, training staff and spending a little bit more time with them. I'm a big fan of, giving a lot of responsibility to my medical assistants and teaching them how to counsel patients, so that, you know, in my template, it goes through very clearly what I want them to review. And so they're able to kind of drop that in. I can say, hey, can you do the counseling on this medication? And the patient gets that time and correct counseling, and just creating efficiencies that way. You know, I think it gives you an opportunity too to look at other options that are out there, and, you know, make sure that you're getting the best value in these different things. There's always new things popping up. You know, there's new practice management tools, new technology, new opportunities for you to look at, even new skills that you might be able to develop. And so I think that that's where I saw the value develop during COVID-19, was people who actually took that time and used it wisely for things like that. And also just a couple of things with some people I interacted with. You know, there are ways that you can buy you know, used but great quality surgical chairs, or you know, same thing with refurbished lasers, or different options that sometimes we don't think about. And then one other thing too that I think was really helpful for my husband and me, he's also he's an anesthesiologist, is private banking. And there are these very specific, you know, private banking services that offer services to people like physicians who are very busy. And they just offered us a lot of support and assistance, especially right at the beginning, when, you know, I mean, it's not usual for healthcare to hit pause, you know, and so it's a very different experience, even for the banks, you know, and the people that we interacted with. But we had such nice representatives who were so supportive, and I think that was very helpful as well, communicating what assistance was there with the PPP. I know, you know, almost every dermatologist I know who running their own practice was able to, you know, get help with the PPP loan and all those things. So and a lot of this, you know, communication with people, sharing the things they were able to do with each other. I think we got that information out to each other and helped as a community.
Now that brings up another important point about sharing information with each other, because Shawn, were you learning everything for the first time as you were like building this practice, or were you able, like, was it like a trial and error for you, or were you able to leverage the knowledge and insights of others?
So a little bit of both, to be honest. I've got a little bit of a background in business as well, and it's something I really enjoy. And so the ability to approach a lot of our different vendors, which is something I was going to echo with April, the ability to go and approach a lot of different vendors and get several different bids, and to be able to use those bids to your advantage. And a lot of these other companies are looking to be able to take on new customers as well. And so approaching them and letting them know about what you're going through, and you're starting a new office and it's during COVID, I think is really important, because you can get a lot of value right now for services with people recognizing kind of the state of affairs of everything. But it was a little bit of trial and error. I definitely leaned on some other people, but a lot of the medical providers that I know don't have an interest in any of the administrative stuff, so they didn't have a whole lot to share with me in regards to that. Most of it was actually leaning on a lot of my friends and colleagues that I have that are either own businesses of their own, or are part of businesses, or do business management. And I leaned on them quite a bit for a lot of the kind of tips and tricks and things that I learned from the process, and then just trial and error, and did a lot of it. And you learn a lot through that, especially during COVID times. I'm
sure. Yeah. And some of the things that used to work great just don't work anymore. Right. True. I feel like that happens sometimes. And I know that in our call, that our dry run call, you did mention that like modernizing medicine, for example, you've used certain services of theirs to help you get going quickly. And
correct.
So it's nice that we're all in it together.
Yeah.
Nice that we're all there to help each other. So, okay, let's go to the next question. Now, this is one that I know that our listeners really care about, which is, how do we compete effectively? Like, you know, with people going to the doctor less, and, you know, the competition for patients basically increasing, how do you differentiate yourself in the marketplace? It's really stand out. Shawn, do you want to take that one first?
So this is where my big plug for Pathology Watch is going to come in, because the best way I would phrase this or frame it is to say partnering with people to do what they do best. That's one of the things that I think can help you stand out in the marketplace. There's a lot of people that try and do things on their own, recognizing that we are primarily clinicians, and that is the reason why we got into this. We are not primarily business executives, and being willing to partner with people that do what they do really well and allowing that to stand out as part of your service is something that will differentiate yourself. With Pathology Watch, being able to say that when I do a biopsy of something concerning, being able to tell a patient that I'm going to have these results within a 48-hour window versus a 2 to 3 week window in previous practices is mind-blowing to the patient, and still it's still hard for me sometimes to pitch to people because I'm not sure it's really going to come true, and it does. But there's a lot of anxiety that come with going and seeing your doctor and going to a dermatologist specifically and something concerning. And even though we try and frame it as to not freak a patient out right off the bat, if there's things that are concerning, people need to know that as quickly as possible. And so having a solution like Pathology Watch has really been helpful for us and helped us stand out a little bit in the marketplace. So patients know that when they come in, it's unfortunate because we get all the credit as if we did the turnaround really quick, but being able to tell them we got the results to them really quickly and they're going to hear quickly is actually very important to them.
Well, I think that's a sign of a good partnership is when the partners that you decide to, connect with and partner with make you look good. So that means that we're successful if we make you look good. So thank you so much. That was really kind of you to say. I really appreciated that. Some other things that you said were maybe leaning on a little bit more on the patient experience. I think you've done a few things that have really brought the patient experience to the forefront. Do either you or April have any specific items that you wanted to discuss about how to make that patient experience be a standout?
Well, I have to say, being in Shawn's office, like, you do feel that way, just the way the layout of the office is when you walk in, and the way they interact with the patients as they walk in. It's fun just for me as a provider being an observer in somebody else's office, and I learn a lot when I kind of go into these different offices. I think the most important thing here is that we all are unique, and the skills or the personalities that we bring are different. And just because I'm a certain way doesn't mean everybody loves me and doesn't love my partner who's different than me. And so I think that we just have to celebrate those differences and find kind of our philosophy about how we want to interact with the patients, what kind of message we want to send. And I think that when we do that, we're able to communicate that to our support staff. Also, for me, one of my main things is it's always about the patient. And so, I run late sometimes when I'm coming out of a patient room. And so, you know what, if a patient comes 10 or 15 minutes late, or they get lost on the way to the visit, it's very different from a lot of providers. But, I never cancel patient. I just let them know, hey, if you want to reschedule, that's totally fine. If you don't, I'll work you in as I'm able. But I never send a patient away because I'm a patient. Yeah. And I know what that's been like when I'm like running to the pediatrician's office and like dragging my kids and trying to get there. And I mean, that's how it is for a lot of patients, especially with COVID and all these other things. We don't know what's going on in patients' lives. And so I think that when you have that philosophy of what's important to you, those things trickle down and you attract the type of patient that you interact best with, that, wants that. Some people, they want to come in, they want it to be very, efficient and in and out, and that's their personality. And, for me, I just kind of like enjoy, a lot of my patients become my friends and feel like family. And so that's kind of how I end up treating them. And I think those are the kind of patients that I attract, for example. So.
I love what you said about it being really based on your values and like living on authentically showing your values through your practice and through your services. That is really meaningful to me. And I remember I was talking to a friend of mine, and we were just like talking about like our OB doctor visits. And I was like, oh my gosh, I love my OB. I'm in and out in 30 minutes. we say hello and how are you? And I haven't seen her for 2 years, and we catch up real quick and then we're out. And then she's like, oh, I just love my OB. We talked for like 2 hours and she just really gives me, and it's so funny because we just wanted something different, you know? I really love what you said about that too. Shawn, any additional thoughts?
One other thought that I had is, I think it does go along with what April was saying, is just finding, and this may take some introspection, but I think finding what makes you unique as an office and as a staff, and being willing to own that and display that. And those patients are going to find you for it. I think there's just throughout medicine in general, there's been this common narrative that you go in, you get told what you're going to do, and then you walk out and you do what you're supposed to do, and you come back when you're supposed to come back. And there's this very regimented approach to it. And I think in terms of trying to differentiate yourself, if your office staff is generally more on the chatty, funny side, I think it's okay to display that and let patients know that that's who we are, and it's okay. And I've had patients that really, really love that. And you find that kind of patient generally tends to find you. Mm-hmm. And inherently as providers, those are the patients that I want to treat anyway. And so it doesn't mean that I don't have patients that, give me the eye roll when I joke around with them a little bit, and they, don't want to be in and out. And those are the patients that I know want to be in and out real quick. And we can do that. But being willing to make, I think one of the biggest things that we did is we make all of our new patient appointments, no matter what, we make them 30 minutes. I know that's probably not terribly unique, but it's felt unique in a lot of the providers I've talked to where all of our new patients are 30 minutes. And I don't care how many people are on my schedule, like every new patient, if I see 10 people in one day and they're all new patients and it just takes up that much time, that to me is totally worth it, to be able to know where they're from, what they're doing, how COVID has affected them. Let's talk a little bit about that. Tell me about your kids. And if we walk out of there and 3 of the 27 minutes was spent on talking derm, I'm okay with that. And it doesn't mean every visit is going to be that way. So people don't have to freak out that every patient's going to expect 30 minutes. But now they know when they come in that I know their name. I know that their son had a baseball game that day, and I can follow up and say, hey, what happened to your baseball game? How did that go? And like April said, I'm a patient and I'm a person, and I like knowing that people know about me and care. And I think that goes a long way in differentiating yourself in the market.
Wow, that was such a fantastic answer. So what I'm getting from learning from both of you is that it's got to be value-based and authentic. It's got to be adaptable. You need to treat people like people, and you need to be willing to make accommodations for that personalized experience. And it sounds like both of you guys really highly value that, and your patients are lucky for it. That's awesome. All right. So we might need to speed up just a touch here. I'm having so much fun talking with it. So, all right. We have 4 more questions and we'll kind of zoom through those. So how were you able to adapt, Shawn, as the COVID-19 regulations changed so quickly?
I can make this one pretty quick. There's a lot of broadness to it, but social media marketing for sure, and telehealth visits. Those by far have been the 2 best ways to adapt to COVID-19, because with social media marketing, that message gets disseminated pretty quickly, as well as putting updates on our website. And the other thing I was going to say is Google My Business. If you have a presence on Google, and it's your business, you can claim that business and then go into Google My Business, and you can put all kinds of updates that automatically generate right underneath your name on Google when people search for you. So those have kind of been the 3 ways that we have really tried to stay up on the regulations and let patients know pretty quickly.
That's awesome. Great answer. April, any other thoughts?
No, I totally echo Shawn. I think that's exactly it.
Amazing. All right. And we've kind of touched on this already, how we were able to cut costs during COVID-19. Any other thoughts besides what we discussed?
One quick one that I found to be really efficient is that I took our spreadsheet that I have that goes over every expense that we have for the business, and everything that is a service that we are paying for. I just contacted every single one of those services and just said, listen, this is where we are at. We're a new office, we're opening. There are some struggles that come along with it. I know that you feel that, and just being willing to be vulnerable and say, these are our struggles, these are our trials. Is there anything that you can do to help me? And I am yet to find any of those vendors or services that have been unwilling to make some accommodations and say, you know what, that's fine. Let's make the next 2 months on me. We're able to cut down your bill for your office by $30 a month or whatever it is. And those little things are both expressions of kind of their partnership with us and with them, and their recognition that things are challenging for them as well. But I think that is something that is worth doing, is contacting the servicers or the vendors that you're using and just explain to them what's going on and ask for some help.
Shawn, I think you're going to have 56 people right after this call all their vendors. I know, that's
such good advice, though, Shawn. I mean, and that I think is where, again, you see that advantage of having people cross over and cross train, and really understand the business. I mean, it's really unique to have a business manager who is a provider and really understands what's going on, what the patient value is, what will matter to the patient versus what could be trimmed up and is less important. And I mean, Shawn's expertise, I think that's so awesome and fun that you could open a practice, and opening a practice, you kind of have a little bit of that flexibility, where you're not slammed with patients in the moment, and you have some time to develop that. So I think that's so awesome.
Yeah, I totally agree. All right, this is actually our last question, and so we're just right on time here. Last question. What are some things to remember before opening up or growing your practice during uncertain times? I'd love to hear from both of you, starting with Shawn.
Okay. Well, I'll give these to you real quick in kind of a list format, and then you can quiz me if you want to hear more about it. But some of the things that I spent a lot of time thinking about this question, a lot of introspection. Number one, I would, kind of going back to my previous comment, almost everything is negotiable. Just per my previous comment, almost everything is negotiable, and then you won't know if you don't ask. Mm-hmm. Be willing to ask for help, and be willing to be vulnerable and just tell people where you're at. Mm-hmm. Instead of assuming that we know all of the things, use professionals like Pathology Watch, like consultation services, like whatever it is, use professionals when you don't know the answer. I have found consultation fees to get some basic advice from people, whether it's marketing or whatever else, to be very reasonable, and you can get most of the answers that you need by just being willing to reach out and get a consultation with people. Other things that I've found helpful is try and work towards month-to-month agreements as opposed to signing any kind of long 2-3 year term agreements with people. I've had most vendors and services willing to understand that and offer a month-to-month agreement for a lot of the services that we need. So, because I don't know what's going to happen, and I don't want to get locked into some 3-year agreement where, there's some net 30 term or whatever it is, where upfront, if I have to cancel because I can't afford this bill anymore, all of a sudden that's going to compound and I'm going to owe them a great mass, amount of money all at one time that I also can't pay. So it's worth shooting for month-to-month agreements where you can.
Oh, that's great advice. Very practical too. April, what about you?
Awesome advice. Those are such great points, Shawn. The things that come to mind for me are that patients are understanding. And, sometimes we worry so much about patient impressions or how they're going to respond or what they're going to say on social media, whatever. In my experience, patients are so gracious. And especially when you're in a new practice. I mean, I've moved offices a couple times and, you're kind of trying to figure out things or new EMR or this or that. And they're just sweet and patient. Again, if you are authentic and vulnerable and a person, they appreciate that and they relate to you and are just so understanding and flexible for the most part. And so that's one thing I would say. And then another is just, people are always going to need their physicians, and we have an obligation to both help them understand the risks, for example, with COVID, so they're going to look to us for our response and our attitude about COVID-19. And, it's not going to last forever. These things, we experience these things, and it's like with swine flu, this is a little bit different, but we didn't know what we were going to get, and those things happen, and then we move on and we kind of get back to, normal. And I think that's the faith we have to have opening up a practice, even in, in the midst of COVID-19. If you're good at what you do and you love your job and love patients, you're going to be successful. And I think that we can have that kind of attitude, going forward, that, hey, it's all going to work out. And that's why we got in this job, because we love patients and interacting with patients. And so I think we just have to keep that attitude.
I cannot sum it up better than what both of you guys just said. It's really about the fact that we really are in it all together, and people are people, and that we are here to help each other out. And so thank you for that great reminder as well. And thank you for all of the practical suggestions. And I know I speak for all of our listeners when we say how helpful this has been for us all, and really appreciate your time and your willingness. And I got some, I got another, I was going to end right now, but I got a question. How are you guys handling office Christmas parties? That's
a great question.
We'll just have to end on that one. But what do you think? Office Christmas parties virtual this year?
That's usually what we're doing. So I think that it's such a busy time for people anyways, and we're all just kind of centering around our own families. Definitely in the office, you create a family, and so you're close to those people. And so I think we do things like, provide thoughtful gifts and kind of let people interact in that sense. But actually, it's been somewhat of a relief for people sometimes not to have another thing to go to. And so that's how we're handling it this year.
What about you, Shawn? What are you doing?
Very similar. We're just going to do, for where we already have everybody in the office, we're just going to do kind of an office lunch type of Christmas party, to where people, a little potluck, and clearly that's going to be a regional thing based off of what the regulations are in different areas too. So where we're at, that's, we're all at the office anyway, so we're just going to do something over lunch.
Yeah. Well, that sounds great. And for me, gifts in the mail. So yes, everyone loves gifts, right? So, well, thank you guys so much again. And thank you everyone for listening in. And we really appreciate your time. We really appreciate Paycom for the opportunity to present.
Thank you.
If you have a chance to be a member of Paycom, please do it. And thank you so much. Have a great day.
Appreciate it.
Thank you.
Thank you.